There have been a lot of specific stories circulating relating to Obamacare, the Affordable Care Act, and specific individuals whose healthcare premiums are supposedly going to go up under the Affordable Care Act. A lot of them turn out to be bogus, and it doesn't turn out, in some cases, that the individual claiming their health insurance will cost more is lying. It appears they just don't know and they don't understand Obamacare. Here's an example. There was a woman named Deborah Cavallaro who was interviewed by Maria Bartiromo. And Maria Bartiromo is a CNBC host. This happened yesterday. And Deborah Cavallaro went on and she said, I'm a hardworking real estate agent up here in Westchester, Los Angeles. I've been featured prominently on news shows because my premiums are going up. And she said that President Obama said people were going to be able to just keep their health plans and that their prices wouldn't go up. And that's not happening with her. And Maria Bartiromo said, she said to Maria Bartiromo, please explain to me how my plan is a substandard plan when I'd be paying more for the exchange plans than I'm currently paying by a wide margin. Now, Maria Bartiromo didn't care to actually figure out what happened. So the LA Times has a column called The Economy Hub with Michael Hiltzik. And Michael Hiltzik, this is worth reading, explains exactly what's going on. And the entire claim that Obamacare is unaffordable for Deborah Cavallaro is based merely on her own misunderstandings. I'll explain. After the interview, Michael Hiltzik called Deborah Cavallaro, and she explained that what she has is a catastrophic coverage plan. She pays $293 a month as an individual policyholder. It has a $5,000 a year deductible, and it limits her total out-of-pocket costs to $8,500. This allows 2 doctor visits a year with a $40 copay. After that, she pays the entire cost of doctor's visits. This is the definition of a non-conforming plan under President Obama's Affordable Care Act. The deductible and the out-of-pocket maximums are really high. This is not a good plan. It's $293 a month, which apparently Ms. Cavallaro likes, but it is just not a good plan. So, what about a replacement plan? As a replacement plan, she says she was quoted $478 a month by her insurance broker, but that's actually not what she would have to pay. She didn't think to look into the website that would tell her what kind of a subsidy would you get. Because remember, Lewis, Obamacare involves subsidies based on income for your premiums. And without saying what her income is, because that is being kept private, this year, her income would have qualified her for a significant subsidy, which she seemed unaware of. At her age, she's eligible for a silver plan for $333 a month after the subsidy. That is $40 more than she's paying now, but the plan is drastically better. The deductible is $2,000 instead of $5,000. You know how quickly you can eat through several $1,000s in medical care. The maximum out-of-pocket expense is $6,350 instead of $8,500, and her copays would be $45 for primary care, but all visits would be covered, not just 2 per year. So this is better than her current plan. It barely costs more in terms of premium, and over the long term, over the course of a year, you should be saving money. So this is a specific story, Lewis, of someone that's being touted by the media, by corporate media, as look at what's happening to this poor person. For $40 more a month, she gets drastically better care. She just didn't know it.
But David, who wants to go and do all that research and crunch all those numbers and do all those things that you need to do to find out the truth? It's very inconvenient.
Yeah, very, very inconvenient. But if people were doing it, then maybe we wouldn't be having this completely it's like a merry-go-round of Obamacare coverage where every corporate media outlet wants to just jump on and get on to talk about premiums.
Well, you got to do what you got to do, David. I mean, come on.